Good afternoon, and thank you for joining us today. My name is Karen Sampson Hoffman, and I'd like to welcome you to our webinar, How to Manage ADHD and Anxiety. Today, we are featuring Dr. Roberto Oliveira, and he has graciously agreed to be our presenter today. Today's webcast is part of CHADD's National Resource Center on ADHD's Ask the Expert series. The NRC is funded by the U.S. Centers for Disease Control and Prevention and provides reliable, science-based information about current medical research and ADHD management. During this webinar, we would love to hear from you. You can ask questions or share comments at any time during the presentation. Dr. Oliveira will answer questions after the presentation is complete. Also, there is a box labeled Resources where you can download the slides for today's presentation. If we don't get to your question today, we have health information specialists available Monday through Friday between 1 and 5 p.m. Eastern Time. You can reach them at 1-800-233-4050. It is a pleasure to introduce today's expert, Dr. Roberto Oliveira. Dr. Oliveira is a clinical instructor of psychology at Harvard Medical School and maintains a private psychotherapy practice in Lexington, Massachusetts, where he specializes in the treatment of ADHD, executive function issues, and issues that students face with dyslexia. He also specializes in the treatment of eating disorders, body dysmorphic disorder, obsessive-compulsive disorder, and personality disorders. He serves on CHADD's Professional Advisory Board and is a frequent contributor to our newsletter, ADHD Weekly. Again, we are pleased to welcome Dr. Roberto Oliveira. Doctor, if you're all set, if you'd like to begin today's Ask the Expert presentation.
Great, thank you. And it is a pleasure to be here and be with all of you here online. And here to talk about a topic, and sort of actually something that we see a lot of individuals who have both ADHD and anxiety. So first is, what are we talking about when we're talking about anxiety? We sort of use that term all the time, I'm anxious, or this person has anxiety. What we're referring to is a feeling of unease that often can express itself in feeling quite nervous, having a feeling of distress, like something bad or dreadful is about to happen. And anxiety is often accompanied by physical symptoms. So you have these sort of cognitive thoughts of something bad is going to happen, or I feel something dreadful. And it's often accompanied by these physical symptoms. It could be our heart racing. It could be our face getting flushed. It could be our hands trembling. You could feel being nauseous. And anxiety often is related to a stressful or uncertain event. Now, that event could be an actual event, or it could be a perceived event, which means that our brain is evolutionarily designed to almost lean on the side of anything suspicious of being threatening. It leans on the side of it actually being threatening, because we are better off surviving if we assume that that rumbling in the closet might be an animal that's going to attack us, than to think it could be something else. And then if it turns out not to be the animal, the tiger rumbling in the closet, then we're fine. But if we assume that it isn't, and it is in fact a dangerous thing, then our survival is threatened. So our brain does the same thing, whether it's an actual threat or something that we're perceiving. So the power of our mind and how we're interpreting events is very, very important. When we do pick up on our radar this idea that something is threatening or dangerous in our environment, and uncertainty breeds that feeling, because when we are uncertain about something, we don't know what's going to happen, which means there is a possibility that something threatening or dangerous could happen, and that's what our body's responding to. Oftentimes when we feel anxious, there is this mechanism in our body, it kicks in, called the fight or flight response, which basically says we either have to kill this threatening thing, or we need to get out of the way and escape as quickly as possible. Those are the only two options, basically, to keep us alive. So to kill the threat or to move away from the threat. And again, this is very evolutionarily adaptive. So to keep in mind that if we didn't have any anxiety response, that wouldn't be good for us. However, within a clinical level of anxiety or anxiety disorders, this is where it starts to actually become evolutionarily maladaptive for us, that if we start to interpret events as dangerous or threatening when they're not, and in fact those events are not only not dangerous and threatening, but might actually be the very thing that is needed for us or healthy. So for example, someone with social anxiety who might avoid people for fear of being evaluated in very negative ways, that then disconnects an individual from social relationships, which are extremely important for our mental health and for our social functioning. Now, why we're talking about anxiety is that about 30% of people with ADHD have anxiety or an anxiety disorder. So it's something that affects many individuals with ADHD. So how does anxiety impact ADHD? The truth is that we know that ADHD symptoms of inattention, difficulty with concentration, difficulties with executive functions, anxiety basically puts flame to the fire, or fuel to the fire rather. That when someone is anxious, it further impacts their attention, someone with ADHD, further impacts their level of concentration, makes them more distractible, except in the case of just ADHD, instead of being distracted perhaps by something pleasurable or by something that's just stimulating, anxiety becomes the stimulation and therefore is a very unwanted distraction. It's very intrusive. People who have anxiety and ADHD find it's more difficult to utilize their ADHD strategies or tools of counteracting some of their ADHD traits. Certainly interferes with executive functions, which already is a difficult thing for a lot of people with ADHD. Things like organizing and decision making and regulating emotions, all those things anxiety makes more difficult. But what's important is that the ADHD brain, which is a brain that is starved for stimulation, it is by nature a bored brain that's very low in dopamine, that anxiety actually provides a level of stimulation for the brain. So people with ADHD, we're oriented in our environment as individuals that are always seeking stimulation or pleasure. But not all things that are, well, I should say all things that are pleasurable are stimulating, but not all things that are stimulating are pleasurable. And anxiety is one of them. And the ADHD brain actually almost invites sometimes anxiety. And I've heard this from many patients of mine who say, gosh, I don't know why, but it's almost as if I'm looking for something to be obsessed about. It's almost like I'm looking for something to be and feel anxious about. Why is that? And I tell them, well, the ADD brain actually sometimes is looking for that stimulation, although it's not a choice by any means for a person to choose to be anxious in that way. We seem to have lost the slides here. So it's very important to look at that relationship and understand that there is a reasoning that goes as to why people with ADHD might even find themselves gravitating to anxiety. The other thing that's important too is with people who have both anxiety and ADHD, that sometimes the anxiety can mitigate hyperactivity or impulsivity in individuals who have hyperactive forms of ADHD. Now, what that means is that I've seen very often in patients of mine, when their anxiety is managed and is under control, individuals who might have been seen as just inattentive ADD, it turns out they're actually more hyperactive and more impulsive than they might have even thought, and that the anxiety sometimes actually acted as almost like a buffer for that. So just something to keep in mind for people who, to understand that sometimes anxiety can almost play a role in sort of mitigating or buffering levels of hyperactivity. So why is it that we see ADHD with anxiety? And 30% is a high, what we call a high comorbidity rate, meaning that we would see these two conditions together. Well, first of all, people with ADHD, other than having a very understimulated brain, often have very sensitive nervous systems, that they feel things either emotionally. You'll often hear from people with ADHD who say that they feel things really intensely in this very intense way. But also even physically are prone to certain distractions, whether it's the tag on the back of their shirt, whether it's the little mosquito bite on their skin that they can't stop scratching, that there's almost this hypersensitivity. And anxious individuals also feel that way too, as if that there isn't almost kind of the proper filters in place to bring in and deal with a lot of stressors in life, that it almost feels like they're more permeable than other people. So that's true also for a lot of people with ADHD who find themselves highly distracted or impacted by their external environment. Also, the genetics of people with ADHD and anxiety. Now, this is certainly true. It's not uncommon for individuals to have ADHD and OCD, or obsessive compulsive disorder, and I treat many people with OCD. And about 30% of people with OCD have ADHD, which surprises a lot of people. Now, interestingly, when they look in the research as to why would we see these two things that in some ways almost seem opposite of each other, but it really isn't, but that could be a whole other presentation, that one of the theories for that is how partners mate and meet each other. It's very common, actually, for couples in which a partner has ADHD to marry someone who either really doesn't have ADHD and sometimes can actually be more on the obsessive side or anxious side. And it's understandable why that might happen, how each partner can almost complement the other quite well. Someone who's quite anxious could really benefit from some of the spontaneity and sort of out-of-the-box kind of ways of being as people with ADHD do, who crave stimulation. But the person with ADHD who might have executive functioning deficits, who might have a difficult time following through on tasks, it could be good for them to have a partner who might be a little bit anxious about paying the taxes on time and doing the bills. So a lot of times those relationships can work. But as a result, when these people have children, you're going to then have this kind of mix of genetics of people with ADHD and anxiety. The other thing is that 50% of people with ADHD have learning disabilities or learning issues. 80% of that 50% are people with dyslexia, so you'll often see ADHD and dyslexia go together. And learning disabilities cause a tremendous amount of stress for an individual on top of what ADHD symptoms they might have, particularly because learning disabilities are often not identified right away, that sometimes it could take years, especially if someone has an ADHD diagnosis. Dyslexia in particular can be very difficult to identify because a lot of times schools or teachers or parents might think, well, he or she isn't comprehending or isn't reading well because their ADHD is getting in the way. They're distracted, they're bored, they're not engaging with the book, when in fact, yes, their ADHD can impact your reading, but that's very, very different than dyslexia, which is an actual language-based learning disability to make it difficult to decode words and to have phonemic awareness, which is very different than what you see with ADHD. Also, people with ADHD are known for not being the best sleepers, and sometimes either being night owls, going to bed too late, waking up too late, not getting enough sleep, being stimulated by video games, the internet, binging on Netflix shows until 3 in the morning, and poor sleep is highly correlated with anxiety, that we will be more stressed and more irritated by something when we are sleep deprived than we could be about that very same thing if we got a good night's sleep. Of course, ADHD comes along with often executive functioning issues, issues with organization, a real frustration over failed intentions, all those goals that people with ADHD want to execute, but somehow it sort of falls apart. Academic stress, job stress, parents who have ADHD find it can be very stressful to not only manage their schedule, but to manage their children's schedules. And sometimes, inattention can be, very, difficult to sort of understand. Is this an inattention that's due to the ADHD? Is it, the anxiety? And sometimes people with ADHD find it could be very difficult to even see the early signs of a problem like anxiety because they're so distracted in a lot of ways. But all of the executive functioning issues cause a tremendous amount of stress and therefore cause a tremendous amount of anxiety, because now maybe you have the college student that is worrying about failing the next exam, and for some valid reasons, because maybe he failed the last two exams because he waited until the night before to study and it wasn't enough, and he has issues with procrastination. So that's where anxiety sometimes can almost feel like it has this valid base, but it nevertheless makes everything harder. So how do we know the difference between anxiety and ADHD? Because sometimes I have clients that say, I'm not sure if I'm just hyperactive here or if I'm anxious. And then I have other clients that know precisely if they have both anxiety and ADHD, which is which. So here are sort of some distinguishing factors. So one is that with anxiety, the anxious brain is oriented towards avoiding threat. So when someone with pure anxiety walks into a room, they are really thinking about what is the thing in this room that could potentially be threatening to me. So people with anxiety often can feel a sense of overstimulation very, very quickly, and often feel this hypersensitivity sometimes to certain sounds or certain situations. And therefore, they might end up avoiding situations. So in someone who's anxious, who can avoid certain situations, that's what they're trying to avoid often, is something that feels threatening, something that might be overstimulating for them, or something that they feel hypersensitive to. Like, this is too much stuff. And so therefore, I'm not going to go to the party. I'm not going to go into the subway train, because all of that could result in me feeling really anxious and perhaps having a panic attack. Now, when people with ADHD avoid, so we're talking just pure anxiety and now pure ADHD, that you'll often hear from ADHD individuals like, I didn't do that. I didn't go to the party. I didn't get this done. But a lot of times the reasons are different. That an ADHD avoidance is often due to the fear of boredom and the fear of being understimulated or hyposensitive. So a lot of times clients might say, or individuals with ADHD might say, oh, I don't want to go to that because it's just going to be so boring. I won't know what to do. I'm going to be understimulated. It's not enough, basically, to sustain my level of attention. That class is too boring, so I'm going to skip that class. So that's not anxiety. That is really an avoidance due to the ADHD, because basically the ADHD brain, as I mentioned earlier, is oriented towards what's going to give me pleasure and stimulation. And so people with ADHD are sometimes too good at avoiding situations in which they anticipate they're not going to get properly nourished with enough stimulation. And it becomes a very negative conditioning cycle, in the sense that the more now that you avoid something, let's say if initially someone with ADHD and anxiety avoids a class because they think it's going to be boring, well, the more that you skip a class, the more information you miss. More information you miss, the more behind you are. The more behind you are, the more anxious you're going to start to get. So it can start as an ADHD avoidance, and then the person is starting to avoid the class because they feel so anxious because they're so behind now. So it can morph into anxiety very, very quickly. And then sometimes with ADHD avoidance, you have some individuals who do get a sensory overload or overstimulation, but don't feel the threat value of that. Meaning, so with anxiety, the overstimulation is, oh, this is too much, and I fear I'm going to get a panic attack, or I fear I'm going to feel really anxious. With people with ADHD, they describe that sensory overstimulation not always in this kind of threat framework, that it's more that, oh, it just feels bad, and I don't want to do something that feels bad. So again, it's really around, I want to put myself in the most pleasurable, optimal environment. So even clients of mine who might say, I avoid this, and no, I don't think I'm going to have a panic attack. I don't think I'm going to be anxious. I'm just not going to feel the best I know I can feel. And sometimes that there are situations that they don't have to put themselves in, but then there are some situations we do have to put ourselves in order to function. The other distinguishing factor that can be confused is the difference between over-focusing and hyper-focusing. With anxiety, an individual is over-focusing. They're basically taking the same data and either ruminating on it, obsessing about it, kind of paralyzed, with it. Excuse me, they're not moving forward. They're stuck. Whereas with ADHD, it can look that way, but in fact, we know people with ADHD, particularly when they're under strong deadlines and maybe when they procrastinated and they're up against a wall, they can often hyper-focus, but that hyper-focus is a fluid, moving train of laser-focused, intense concentration, sometimes to the detriment of everything else that might be going on around them. But it's very, very different in that it's not anxiety-based. So when people are hyper-focused with ADHD, they don't report feeling anxious. They report almost being kind of so in the moment that they're just on this like runaway train that they're kind of just focused on. Whereas the person with anxiety is frustrated when they're over-focused. They can't move forward. They can't move past. Very, very different. People with ADHD actually often sometimes procrastinate so that they can hyper-focus, because that feeling, as someone with ADHD, I can tell you that feeling is incredibly stimulating. Although it's not, it's a mixed bag, because I could recount times in my life where I've hyper-focused and wrote papers overnight to the detriment of my sleep, and then the next day feel totally awful and get sick because my immune system has crashed. Anxiety, it's so important to also understand what's the genesis of the attention deficit, because I've also seen clients who are diagnosed with ADHD when in fact they don't have ADHD. They have anxiety or they have obsessive compulsive disorder. So a lot of times we want to know what is distracting you. So with someone with ADHD, it could be that they are disconnected from what's going on. Let's say if we take a student in the class, they're disconnected from class, they're bored, and then their mind wanders, and then they might focus on the bird that's flying outside the window. The person with anxiety could get that attention deficit because what they're distracted by is an anxious thought. So they might be totally in tune with the class and interested, but now they're thinking, it could be, this kid next to me is sick, and what if I get sick? It could be, oh my gosh, I don't know if I'm going to do well on this test. So the distraction is the anxious thought, is the anxiety, which is different than what you would see typically with ADD. You want to understand, are the executive functioning deficits something that's primary, as in the case of ADHD, or is it more secondary executive functioning deficits, which means that when someone is anxious, and only when they're anxious do they notice that their ability to get things done is impaired, but when they're not anxious, they have no problem getting those things done. So we want to make that distinction. Is it ego-syntonic or ego-dystonic? And what that means is it something that someone basically is okay with as an ego-syntonic, or they really, really don't like it, which is ego-dystonic? And sometimes even with hyperactivity, people with ADHD could find it ego-syntonic in certain situations. Anxiety is always ego-dystonic, that there's nothing that people who are anxious like about the feeling of being anxious. Although there are some times with people with anxiety and ADHD that might say, well, I don't like the feeling of being anxious. However, that's the only time I could get things done, is when I'm anxious enough that helps with my ADD. So it's this conflict where they feel that they don't like the feeling, but at the same time they like the result, that if it gets them something done. But ideally, we don't want someone to have to go through tremendous anxiety to get something done. So we want to inquire about the anxiety and know the beast of anxiety. We want to understand it. Now, in terms of treatment, is really at the beginning is health hygiene. Sleep, again, is so important. I've done many webinars about the importance of sleep, particularly for the ADD brain. Exercise is also really important. In fact, when we exercise on a routine basis, there is something called gonadotrophic brain-derived neurotrophic factor, or BDNF, which is basically an enzyme that helps the communication between neurons move quicker and faster. So our brains actually benefit from exercise and help tremendously with anxiety. That for people who are anxious, when we exercise, it's a great way of discharging a lot of just physical stress and tension. Healthy eating, Having proactive minimization of stress, and what I mean by that is sometimes looking in the future, which can be hard for people with ADD, to almost say, okay, I know that generally I get really stressed out the night before an exam, but now that it's 3 days before the exam, let me put it in perspective. Let me almost try to inform my future self why it's not as bad as I'm going to think it's going to be. So that requires that you almost know what your buttons are, that you know what your anxious pockets are, and can almost speak to it when you're in a better, clearer state of mind. It's very difficult when we're in the midst of tremendous anxiety, certainly when we're in a place of panic, to just simply calm down. Like, that's a very difficult thing to do. Surround yourself with affirmative people. Humor is a wonderful, Sigmund Freud said, humor is the best defense mechanism. It's the healthiest defense mechanism. If you're feeling anxious, if you're feeling that sort of tension, I go to funny YouTube videos. I'm a big fan of stand-up comedy. I'll play a couple clips from some of my favorite comedians. Laughter is really a good antidote to anxiety. It's very difficult to be completely anxious while you're laughing because your body secretes certain neurotransmitters and hormones when you're laughing that actually work against anxiety. Watch your caffeine intake. That certainly doesn't help anxiety. Limit or eliminate alcohol use. Alcohol it has a lot of inhibitory factors, which then make us in some ways more susceptible and more vulnerable to things that could make us anxious. Smoking does not help. Now, a lot of people who are anxious will smoke as a way of trying to minimize their anxiety, and on the short term, nicotine can have that effect, but in the long term, actually sets someone up to be more anxious, and tobacco companies know that all too well and capitalize on that. Sobriety is necessary to be able to learn to tolerate anxiety. So when I have a patient who's dealing with their anxiety through the use of drugs or alcohol, we have to deal with sobriety first, because there's no way you're going to really take up a lot of the techniques if you're using. The other treatment is really the ADHD component, is boosting your executive functions, that we want to externalize basically our frontal lobe into our environment to minimize stress as much as possible. So if you're late for things and that causes you a tremendous amount of stress or anxiety, writing out your schedule, setting timers, setting alarms. If you get anxious that you're going to forget something, your working memory is going to be affected. Using verbal cues, writing things down so you don't forget them. Your environment is incredibly important. I work with lots of people who have issues with hoarding, which is very common or I should say ADHD is very common in people who hoard. And when we have clutter around us, it's just going to often make people that much more anxious. It's very difficult to think clearly. So even things like that can really make a much more substantial difference than someone might think they would for their anxiety and for their ADHD. Decision making, try to limit options when you can. Too many decisions, or too many options rather, is too overwhelming for someone with ADHD and for someone with anxiety. I remember once going into a pharmacy looking for my Arm & Hammer baking soda toothpaste, and there were like 7 different varieties of this toothpaste, and I thought, oh wow, I didn't realize all those. Do I want the tartar control? Do I want this? Do I want that? And I realized as I was standing there for 15 minutes determining what toothpaste, that I just wasted 15 minutes of my time, and I just got the good old classic that I get. And I think we're a society that sometimes is lulled into this myth that having lots and lots of options is always better, and that's actually not true. The human brain is really not meant to handle that many options, so sometimes we have to do the work of limiting those options. Staying on task is super important, and tools like fidgets, or what I call feng shui ADHD style, setting up your environment to stay on task. For me, I need to have a window in a room that I'm writing or working in. That helps me. I do not get distracted. I get more distracted if I'm in a windowless room. I need to have lots of light in a room, lots and lots of light in a room. That might be blinding maybe to some people, but for me it works very well. I have to have music playing in the background anytime I'm writing a paper, and that's been the case since I was in the 3rd grade. So I'm setting up my environment to basically boost my executive functions, which then reduce my tendency towards being anxious, because if I'm able to stay on task, then I'm not going to be anxious about these tasks that I have to do. Being cognitive therapy can be very helpful. Being mindful of your thoughts, particularly anxious thoughts that sometimes can be quite distorted or inaccurate. I know that if I go to this party, no one's going to talk to me. I know I'm going to fail this test. Assess that for evidence and accuracy. Challenge those thoughts, and know that people with anxiety really look at, often are more focused on the possibility of something versus the probability. So, for example, if someone is anxious about flying on an airplane because they fear it's going to crash, is it possible the airplane can crash? Absolutely, it's possible. Is it probable? It actually isn't probable, because the truth is, statistically, the number of planes that fly every day, every week, every month, every year, there are very, very, very few plane crashes. The problem is when there is one, we hear about it, and it sort of sets up this notion that it happens more often. So when you're anxious, you want to say, okay, I know I'm focused on the possibility of something, but let me try to put it in probability terms. ACT, which stands for Acceptance and Commitment Therapy, which is sort of an offshoot of cognitive therapy, talks about acceptance and accepting that we are not immune to anxiety, that anxiety is a part of the human condition. And if we try to avoid feeling anxious too much, that can lead to suffering, which is a real disconnect. Now, it doesn't mean we have to have an anxiety disorder, but it is part of the human condition to be anxious about certain things. So we don't want to be fearful of the feeling so much so that we avoid the situation or we numb ourselves with food or alcohol or drugs, but we want to be able to feel it and accept it and then work at a strategy. Be aware of our thinking if we're having all or nothing thinking. Overgeneralization, that would be because I failed this test once, I'm always going to fail this test. Filtering is when we focus on the negatives of a situation and we kind of discount the positives of it. Personalization, people with social anxiety, for example, might think, oh, that person is looking at me in a negative way, when in fact that person might not even be noticing. The idea of what we call control fallacies, that we should be able to control everything. We don't. We have a certain amount of control, and people who are anxious often have a very difficult time almost accepting that they don't have control over certain things. The shoulds, we want to be aware of should language. I should be able to do this like everybody else. I should be able to do this quickly. And something called emotional reasoning. I feel anxious, therefore something bad must be happening. That's not true. We can feel a certain way, and it could have nothing to do with what's actually happening in the environment. Behavioral therapy, deep breathing, mindfulness, paying attention to your five senses is a great way to be in the moment and reduce levels of anxiety. What are you tasting, touching, smelling, hearing, and seeing? That puts you right in the present moment. Which anxiety is something that often exists by thinking of past things or worrying about the future. It's really not about being in the moment. Something called progressive muscle relaxation, which I would recommend honestly for anyone to do. It's basically this exercise where you're tensing various muscle groups for about 10 seconds and then relaxing them. And it's I actually do that a lot of times just to get to sleep, because going to sleep every night is a challenge for me. Sometimes because of anxious thoughts, and sometimes because of just, ADD stimulating thoughts. But it helps really relax the body. There are great YouTube videos that you can check out on PMR. For people who are avoiding situations that they need to actually be participating in, exposure therapy, which is the gold standard of treatment for obsessive compulsive disorder, is warranted. That the goal is not to avoid anxiety 100%. If the thing that you're avoiding are also situations that you need to put yourself in. A technique called the worry hour. Sometimes what we get anxious about most is getting anxious. That when we actually flesh out the thing that we're anxious about, we realize that if we just sit with that thought, and I mean, honestly, when I assign to people to do for an hour, by a half hour, they're already bored of the thought that just thinking about made them anxious before. But if you actually sit with an anxious thought, it's just a thought. That's all it is. It's just a thought. It doesn't mean that anything is actually bad is going to happen. Soothing with the relaxing stimuli. Sometimes distraction with intense stimuli. So a lot of patients of mine, when they're very, very anxious or on the verge of panic, might take a really hot or cold shower, and that really kind of jolts them out of the anxiety. And as far as medications, we know for ADHD, there are the stimulants and non-stimulants. For anxiety, these selective serotonin reuptake inhibitors, like Paxil, for example, is one of them, Luvox or paroxetine, fluvoxamine. Benzodiazepines can be helpful for anxiety, but not as a long-term. They can be highly addictive substances. So for people with ADHD, I often am very wary of that. I don't prescribe medications, but in consultation with psychiatrists. Certain beta blockers that can help. I have patients who are musicians or are in sort of careers that are very performance-based and find that beta blockers can be helpful when they're during an event that they have to do. Preliminary studies have shown that atomoxetine or Strattera can be very helpful actually for people with that comorbidity of ADHD and anxiety. And just a quick note also to say that there is something healthy also about feeling anxious, that sometimes I hear parents say, I wish my kid was more anxious, or I wish my husband or wife were more anxious about paying the bills, and that they should be more nervous that the lights are going to be shut off, or we're going to get in trouble by the IRS by not getting our taxes in. And people with ADD are sometimes too good, again, at avoiding things and almost really disconnecting themselves from feeling anxious. So connecting to an actual future stress can be adaptive. That's motivating for a lot of people. The reason that a lot of people who don't have ADHD or executive functioning issues, or maybe some that do as well, do certain things is because they fear the consequences of not doing those things. They're in touch with that. And people with ADD sometimes have a very difficult time with that. So healthy anxiety can also propel us into action. So anxiety isn't always a bad thing. There are a lot of obstacles to treatment, sometimes resistance in engaging with the anxiety. Even talking about anxiety can make people anxious. Some people, especially people with ADD and anxiety, can feel an ambivalence about getting rid of the anxiety if they feel it's been helpful in propelling them. Missed sessions, sometimes medication noncompliance, overuse of certain medications, especially with people who are anxious. You always want to be aware of self-medicating, going beyond the prescription. And again, as I mentioned before, it's common for some ADHD symptoms to increase as anxiety decreases. So I will stop there and look forward to questions that you may have.
Wonderful. Thank you so much. Our questions are starting to come in, and I would like to share with our audience, if you're having difficulty submitting a question through our question box, you can email us right now at asktheexpert@chadd.org, and we can include those email questions at this time. So our first question has come in, and our participant says that she has a son who has ADHD, and he always wants to know what the plans are in advance. Is that a type of coping mechanism for his anxiety, something that maybe can help him handle what's going on?
It's a great question. So I would say it could be either or both. So it's very common, if we just look at it through an ADHD lens, that individuals with ADHD sometimes like to have a certain level of certainty, and sometimes that could be an anticipation of how they might prepare for those kind of things. Sometimes it could be, okay, if we're going to this thing that's really boring, how am I going to entertain myself in that situation? And then there's the anxiety lens, which is I like to have, also on the ADHD lens is the importance of structure. That people with ADHD who work really well and kind of get their strategies down find that structure can be very, very important to them, having a schedule of things. And that's something that sometimes can almost be it can look like almost an overcompensation where they need to have a structure for everything, and it can be very difficult for them to be flexible once a certain structure is in place, because for them, the shift of thinking that A is going to happen and then at the last minute B happens actually is executive stress for an ADD brain. Now, the anxiety component also speaks to that, because if I don't know the plans, then that means there's uncertainty, and where there's uncertainty, I have no control or no understanding of what can happen, which means now anything can happen, and that makes me really anxious. So it could be a little of both, playing out. So I might even ask, uh, let me know, what's important for you about, knowing the plans, and not to make them feel bad about it, just saying I'm curious how that could help. If the individual seems anxious in some ways, what will be important is not to guarantee that those are the plans solid, to say, well, these are the plans that we set for now. But of course, things can sometimes change. Like today here in the Boston area, it's going to be snowing. And so there are plans that maybe after school were in place that might not be in place because it's snowing and the traffic is going to be bad. And so kids need to understand that as well and be flexible. So you never want to guarantee this is exactly how it's going to be, but to say with great certainty this is how it's going to be. But there's always sometimes that plans can change.
Great, thank you. Again, for our participants, if you'd like to submit a question and your question box isn't working, email us right now at asktheexpert@chadd.org. So our next question is coming from Emily, and she says that her son has ADHD and anxiety, and his anxiety is coming out that he's having difficulty sleeping at night. He does not want to sleep alone, and he will often come into his parents' bedroom or bed at night, and if they refuse, it ends up being a nightly battle, and he ends up on the floor. What would you suggest for her family?
Yeah, so this is actually a very common situation that I've seen with kids with ADHD and anxiety. So for starters, it's important to understand that a child with ADHD, and I can speak to this certainly on a personal level, it's very, very difficult to shut the brain off at the end of the day. And because the brain doesn't naturally and quickly fall asleep, it now is almost open to anything that sort of enters into the brain. So whether that's, oh, I'm excited about this event I'm going to tomorrow, or I wonder how I did on that test, or it could be, I wonder if there's a monster under my bed, or I wonder if someone close to me is going to die. And those thoughts can really enter in. So part of the work is setting up the environment in a way that, like for example, if the child has very light music, instrumental music, on repeat, like the same song on repeat. Not loud, but loud enough that the child can sort of attend to, that basically is filling up that space that the anxious thoughts can sort of flood into. And something like that can be very, very helpful sometimes in just kind of keeping someone not thinking about all of those other things. The other thing is that people with ADHD, there is evidence that shows that they take a longer time to fall asleep, and they also are more impatient when they can't fall asleep very quickly. So it's this double whammy, this sense that they believe that if I don't fall asleep within 2 minutes, then I'm never going to fall asleep. And then they start getting frustrated or anxious that they're not falling asleep, and then that activates their body and makes it difficult to fall asleep. And so part of it is also setting an expectation of, excuse me, behaviorally, of saying, the average person takes 15 to 20 minutes to fall asleep. And so we want to at least try to work at that time. And then with that individual, they're not being manipulative by coming in the bed. They just, when they sleep in their parents' bed, they're just somehow more regulated and more soothed in that level. But the goal is you don't want to accommodate that behavior, because then you could have a child that into their teens is just conditioned that way. Because when anxiety gets accommodated and enabled, it gets conditioned very, very quickly. So, but at the same time, you don't want to cold turkey say to the kid, nope, you're just going to sleep in your bed. So you set up a plan to say, okay, you have to be in your bed for at least 5 minutes before you get up. And then the next night it might be, or the next couple nights, 10 minutes, and then 15 minutes. And you sort of extend it where they cannot come into the bedroom until a certain time. Or sometimes I have parents that say, I'll come into your room at prescribed times, to check in. And sometimes when a child knows, okay, mom or dad is going to check on me, they're better able to almost kind of resign to slumber and then end up falling asleep. It's more what ends up keeping them awake more is being anxious. But definitely something you want to work on, and ultimately in a behavioral therapy model, which would be really important.
Thank you. I know a lot of parents have that concern with their young children. Well, our next question now comes from a grandfather, and John was saying that his son has both ADHD and general anxiety disorder, and he finds some calmness by playing video games where he can be successful and not feel criticized for his performance. What is your advice about reducing his screen time and reducing his screen time and also reducing his anxiety?
So it's a good question because I wouldn't necessarily say that playing the video games is a bad thing. I mean, that could be, provided that it's not getting in the way of his getting other important things done. But anxiety is also very impairing and gets in the way of things. So sometimes if video games are what soothe him, and he's doing it not like 5 hours a day in this addictive style. I think he might have found sort of something that sort of helps relax and soothe him. The key, again, is that let's say if he's in a situation in which he can't play video games, you need more than one strategy. Because what if you're in the middle of Disneyland with your kids, you're not gonna, and you get anxious, you're not going to find a laptop and start playing video games. It's going to be difficult to do that. So you want to definitely have other strategies like the deep breathing, like the progressive muscle relaxation. I mean, the great thing about progressive muscle relaxation or deep breathing is you need nothing but your body. You have all the tools that you need with it in that way. GAD, or generalized anxiety disorder, is for a very, very common diagnosis with ADD. And people with ADD will sometimes say that they almost find the model I had mentioned earlier of almost finding themselves gravitating to worry. Even if there's nothing to worry about, they almost will find the flavor of the week, like the thing to worry about, because those worry thoughts, as distressing as they are incredibly stimulating to the ADD brain. So it's almost like this bad kind of stimulation. So matching that stimulation with almost either an equal amount or more intense stimulation, and that's where video games might come in. That's where running, on a treadmill to get your heart rate going. We often think of anxiety techniques or anxiety management as soothing, as deep breathing, which could be helpful, but also we have to understand what warrants what situation. So people with ADHD who have anxiety, sometimes they have to meet that anxiety by an equally intense or more intense stimulation. So I know for me personally, I'm a huge music lover and a big music fan, that sometimes I need to listen to Enya and some classical music to sort of relax and calm down. And other times I'm blasting Green Day and Nirvana, and that is what relaxes me. So it's important to also know that what works for whereas someone who just has anxiety is probably not going to want that they would find that overstimulating, punk music or something like that. And that's where having ADHD is important to know, okay, I might have to think a little bit outside the box and sort of see what function this is serving for me.
Great, thank you. I think that's going to be helpful for a lot of our participants. Well, Donna was hoping you could expand a little bit on how ADHD behaviors may increase when anxiety symptoms decrease.
Yes, so this is a very, very common thing. And, I think about actually even in my own family, I can share a personal example of I have an older sibling. He has ADHD, and when he was in elementary and in middle school, he went to a Catholic school, and at that time, the nuns could hit you. It was perfectly acceptable for the nuns to slap you, with a ruler, to slap you, with their hand. I did not go to this school. I don't think it would have fared well for me. And so I think for a kid who, by nature, actually was hyperactive and quite impulsive, in school that never presented itself. He was actually a model student for fear that if he moved the wrong way or did something impulsive, he would be hit. And so there's almost this like anxiety / fear that basically mitigated his hyperactivity. Now, when you have someone like that, let's say go off to college where you don't have nuns that are hitting you, in college. And I've seen this many times actually with people that are like, I don't know if I have ADD. I never had a problem until, with impulsivity or anything until I went to college or until, and then I'll ask them, well, tell me a little bit about, how, how your life was like before. And it might be that they suffered from a lot of anxiety that actually restricted them and inhibited them in a way that once the anxiety sort of lifted, once there wasn't that, then it was almost as if all of those dormant, hyperactive, impulsive symptoms were just right there, ready and rearing to go. Because if you think about impulsivity, I mean, the term impulsive is that we're acting really without thinking. And so that's a good example of, many parents who have highly impulsive, hyperactive kids who have heard, I mean, I certainly have heard more than once in my life, why would you do that? I mean, how would that not make you anxious to do? Like, what would make you make that decision? So that's a good example of where if we had almost like a little bit of anxiety in those impulsive situations, maybe we wouldn't do, some of those things. So that's why I say a lot of times the diagnosis, sometimes it's very easy for one of those to be missed or to have even the ADHD missed. I've worked with many people who come in and they're diagnosed with OCD or GAD or social anxiety, and I can sense that there's something else going on, and parents are like, no, I'll ask them about ADHD. No, we don't think he or she does well in school. And then when the anxiety symptoms start to decrease, sure enough, we start to see even like a lot of executive functioning deficits that it's not that they were absent before, but really the person who's highly anxious was just running, like almost treading water to get through it before, and almost didn't realize to the extent of how much work they were putting into sort of just mitigating that because they were so anxious about failing or not getting the A, if let's say they're an academic perfectionist. But then when we work on the perfectionism issue, and it's not the end of the world if you get a B, suddenly we start to see these executive functioning deficits, and it's not that they weren't there before, it's just that the person was literally gassing themselves out to make up and overcompensate for those deficits.
Great, thank you. Lisa finds your presentation of you very interesting, and she was wondering about how many people have both ADHD and anxiety, ADHD and depression.
So ADHD and anxiety, we know about 30% of people with ADHD have anxiety. It's like clinical levels of anxiety. So that can come in the form of generalized anxiety disorder, obsessive compulsive disorder, social anxiety disorder, a phobia, and just sort of what we call more kind of subclinical levels of different forms of anxiety. With depression, about 20% of people with ADHD have clinical levels of depression. About 20% of people with ADHD have bipolar disorder, which is something I actually at the last ADHD conference I was talking about. So, I often say actually that ADHD rarely travels alone, that when I work with someone with ADHD, I'm always assessing for the presence of anxiety, mood disorders, eating disorders, substance abuse, various addictive behaviors, trichotillomania, which is hair pulling or compulsive skin picking. Again, not that someone can't just have ADHD, but I always lean on the side that there's something else probably in the mix.
So I think we are at our last question now. And Bridget is asking this one. Her son has both ADHD and anxiety, and at the moment they are only addressing the ADHD symptoms, but his anxiety is become too much now. They are concerned about adding too many medications to his treatment. What would you suggest, not simply for this young person, but for others, where we are talking about carefully managing medications and other options to address anxiety symptoms besides medication?
Yes, so the real key here is really understanding the ADHD and the anxiety. So if the anxiety is really secondary to the ADHD, meaning that what the thing that the person is reporting is, I am anxious because I can't get things done. I am anxious because I can't pay attention. I'm anxious because I impulsively blurt out things and my friends get really mad at me, so I'm always worried that I'm going to blurt out something. Those are all ADHD related symptoms. So if you treat the ADHD, let's say through medication, I wouldn't say, oh, well, let's put a medication for the anxiety, because we know that those anxiety symptoms are coming from the ADHD. So working with a psychiatrist, I would say, let's medicate the ADHD if they're open, if they want even medication in the mix. But as far as medication goes, ADHD, and then we're probably going to see a vast decrease in anxiety symptoms. However, if I have someone, let's say, who has ADHD and it turns out they also have OCD, just medicating the ADHD actually can even make their OCD worse. So for a number of people who have anxiety, when they're on a stimulant, guess what? Sometimes the stimulant actually helps them focus more on the things they're anxious about. So sometimes stimulant medication is contraindicated when a full-blown anxiety disorder is also in the midst. Now, sometimes it can be helpful. So I have OCD and ADHD patients who are on stimulants, and it helps them focus on the things that they're supposed to focus on, which helps them move away from their obsessive thoughts. I have other patients with ADD and OCD who cannot take a stimulant because their obsessive thoughts go through the roof. All they're doing is, on a very detailed level, thinking about all the things that are making them anxious. So it isn't always contraindicated to treat both conditions if they are independent kind of conditions that are really just impacting each other and almost breeding the symptoms of both of them. So similarly with non-pharmacological treatments, in terms of psychological treatments, is really understanding, is the anxiety just secondary to the ADHD and executive functioning deficits, or are we looking at this independent diagnosis that even when the ADHD is managed and treated and someone feels like they're in a good place with their ADHD, their anxiety is still not treated? You kind of have to have a more integrative approach at making sure that you're kind of dealing with both of those.
All right. Well, thank you. We've had a lot of questions, and unfortunately we weren't able to get to all of them today. We are finished with our questions. If you have other questions, of course, you can always give us a call at 1-800-233-4050, and we're available Monday to Friday, and you can talk with one of our health information specialists. Dr. Oliveira, I want to thank you for this wonderful presentation, and to our participants, thank you for joining us today. If you save the date, our participants, our next webinar is coming up, and that is what you need to know about students with ADHD and, I am so sorry. Our next webinar is March 15th, and it will be featuring Christopher Willard, and he is the author of Growing Up Mindful and Raising Resilience. If you have joined us before, you should be receiving an email that will help you sign up for Dr. Willard's Ask the Expert coming up. Our quick five-question survey will be coming up shortly. If you'll take a couple moments to answer the questions, they help us to better meet the needs of the ADHD community to plan our Ask the Expert webinar sessions. And we value your input and your suggestions in identifying topics for future webcasts. So thank you again for joining us, and this does conclude today's webcast. Dr. Oliveira, thank you so much for being with us. We've thoroughly enjoyed having you and the time you've taken with us today.
Thank you for having me. Always a pleasure.